women and heart health. It is our month to talk about this, February, and I have a tremendous amount of respect for what the American Heart Association has done in the realm of the um, red dress campaign. And I think they've done a tremendous amount of work on recognition and acknowledgement of this issue of heart disease. And I'm going to bring us on a journey tonight to suggest perhaps we can even do more, which is very exciting. For those of you who don't know me, I live in Spokane, Washington. I have a clinic here in Spokane called the Heart Attack and Stroke Prevention Center. So I spend my days in a clinical setting, which I'm honored to do, and I love that very much. I also spend my days and evenings and often weekends lecturing and learning with my dear colleague, Dr. Bradley Bale, and we together started about 20 years ago, the Bale-Doneen method for the prevention of heart attacks and strokes. Throughout this program, I'm going to be respectful of the fact that I don't want to do a lot of self-promotion, but I also want to leave tonight with giving you some tools for which you can take the next step and get healthy. So just a few little housekeeping items. This talk is going to be taped. And with that, I encourage you to share it with your friends and your family. Maybe go back and listen to it again if there's areas that seem particularly interesting to you. My goal is to do this talk in 1 hour, and that will be a wonderful opportunity for us to synthesize quite a bit of information. Okay. So with that being said, I do want to acknowledge my academic appointments at the Washington State University College of Medicine, University of Kentucky College of Dentistry, and the Texas Tech University Health Sciences School of Nursing. So with that, we will move forward. Whoops, I'm locked up here, it looks like. Let's see. I'm not sure. There we go. It doesn't want to proceed. Okay. So our daughters, mothers, and sisters are suffering more heart attacks at younger ages. It is now time to learn the facts and get the keys to prevention. We must learn what we can do now to stop heart disease. My outline for the evening is as follows. I want to address awareness. We need to be aware that this disease affects us in a tenfold reality, even more than breast cancer. And I think that's something we hear, but we really don't think it will happen to us until it does. I want to go over a few simple concepts of what actually causes a heart attack. And I want to talk about inflammation, which seems to be the missing keystone in this whole discussion. I want to go into some root causes of inflammation and then synthesize it all with an action plan that we all can do right now, even starting this evening, and then share with you an educational program called Arterial Health Assurance for Life. So let's jump into it. Let's give a tremendous amount of respect for the Go Red for Women campaign, which has unveiled this year some very common myths about heart disease, silent heart attack risks and symptoms. They go over causes and prevention of heart disease. And it made me think, because the statistics really have not been going in our favor as far as reducing the amount of hospitalizations with heart disease. And I've often thought, well, what are we missing here with this tremendous campaign? And it made me think, well, when did the Red Dress for Women campaign start? And it actually started in 2003 by Mrs. Bush, actually. She started the Red Dress Project February 14th, 2003. So 17 years ago, almost to the date of this evening. And what she focused on and the campaign focused on back then were exactly what's being discussed now. And I pointed out some of those just in the paragraph. They focused on leading healthy lifestyles, encouraged women to take care of our hearts by eating healthy foods, routinely exercising, and by seeing their doctor regularly for preventative checkups. And while that's all very important, 17 years later, why are the statistics not improving? What are we missing? When we look at the current literature out today, and we realize that more young women are having heart attacks, and that's been very well published. Matter of fact, the proportion of heart attack related hospitalization rates for women ages 35 to 54 have increased from 21% to 31% over the last 2 decades. And in Time and other public media, doctors have expressed concern and almost a puzzlement as to how this could be. If you look at the Center of Disease Control sort of mapping of women having heart disease age 35 and older, and this looked at heart disease death rates, it's really compelling to look at this schematic of what we're dealing with. And you can see sort of the same pattern of sort of the southern belt, and it works its way up north. And the thing that got my attention with this is that sort of color schematic of event rates and death rates for heart disease in women has not changed. It has continued, and we need to simply stop and ask, what can we do better? The statistics are as follows. 1 out of 3 of us, unless we do something different, will suffer a heart attack or stroke in our lifetime. Matter of fact, heart attacks occur every 25 seconds for men and women. Every minute, someone dies from a heart attack. 1 out of 3 women will suffer an ischemic event, including a stroke. Matter of fact, every 4 seconds, someone in the United States has a stroke. Women have the highest rate of recidivistic stroke, which absolutely has to stop. Recidivism means a repeat offender. So women have a stroke, particularly young women, and they're at the highest risk of getting back for another stroke in a very short time frame, actually. 64% of women who die suddenly have a heart attack have no idea that they even have heart disease. And I will acknowledge, and I've been talking about this for a long time, Dr. McSweeney published this data way back in 2003, that when women were asked, what did you feel like prior to your heart attack, about a month before? They said, I just felt kind of tired. I wasn't sleeping well. I had some unexplained anxiety. At the time of the heart attack, women reported shortness of breath, abdominal pain, and sweating. And we could take any of those 6 symptoms and blame them on things called life, blame them on things called perimenopause or menopause, on stress, and it feeds the statistical sort of bed that women may present later to the emergency room. They may dismiss their symptoms later. They may be missed even in a traditional medical setting unless acknowledgement is made that actually, if you feel differently than you ever had before, consider the plausible reality that it could be a heart attack. It is absolutely time for change. We can't wait any longer. We must ask, why are these statistics rather not getting better? What is being missed? If heart attack related hospitalization rates for women ages 35 to 54 increased from 21% to 31%, despite the American Heart Association gaining a lot of traction and a lot of acknowledgement from the Women's Red Dress campaign, what is being missed? Part of it is our system. We actually have a healthcare system focused on sick care rather than, quote, health care. When we look at our health span, the sad reality is in most insurance-guided practices and in insurance-guided entities, women and men for that matter, but I'm going to focus on women this evening. Women are picked up to have heart disease after they've had a heart attack to prove it. Women are picked up to be stroke risk after they've had a stroke to prove it. Women are told they're type 2 diabetic after they develop type 2 diabetes. So the idea of backtracking that journey and saying, we need to be recognized before we suffer a heart attack, before we suffer an illness event, with the intention to have our health span match our lifespan. That's something that we really need to focus on. So how can we be recognized that we may have risk before we have an event to prove it? Because waiting is not the answer. Here's what the American Heart Association tells us to do to allow that to happen. They say get annual checkups, make sure you know your blood pressure, cholesterol, and blood sugar. Know the symptoms of a heart attack. I agree with that. Tell your doctor if you had any pregnancy complications. I agree with that as well. Get enough sleep. tame our stress, and find a health partner, find a health coach, a healthcare provider who can assess you regularly. Those are the 6 things that we're told to do. And yet, even if we do all of those 6 things, there's something really vital missing in those recommendations. While they're great, there's certain things missing. One of the things that are missing in those guidelines is the individual approach that's necessary to prevent an event from occurring. We are all unique, wonderful individuals. So what diet recommendations might be good for one person may not be good for the next, etc. So what's missing? Why are we seeing more women hospitalized for heart attacks than ever before when this campaign has been rolling for 16 to 17 years? What's missing in the discussion is the recognition that inflammation is truly the driver of arterial disease. We, Dr. Brad Bale and myself and all of our colleagues in the country have been talking a lot about this. And matter of fact, in our newsletter this month in February, and make sure you get a hold of it if you haven't yet, my first story is targeting brain inflammation to be the key to preventing Alzheimer's and stroke risk. So if we do all of our many of our discussions for health versus illness under the auspice of inflammation, we can start to put some sense in this whole idea. In other words, it's not as random as we perhaps believe it might be. So add in the word inflammation as you're trying to tease out your own personal risk. So let's talk about that a little bit further. Nelson Mandela taught us that education is the most powerful weapon which you can use to change the world. So my world is getting myself educated enough that I can help my patients prevent these events from occurring. Your world tonight is to get educated on this whole issue and perhaps share some of this information with others. But I really do thank you for being on this call tonight. You know, we've known for the last 164 years, it was first proposed by Dr. Virchow, I'm not pronouncing that correctly, I realize, that inflammation is the cause of atherosclerosis. And I know that's a big word, but atherosclerosis really means inflammation and plaque development in the artery wall. I'm oversimplifying it for the purpose of discussion. And then in 2017, the world is starting to pay attention. There was a really important piece of literature published and a trial published called the CANTOS trial. And it established beyond doubt that inflammation is a treatable pathogenic mechanism in atherosclerosis. And if that is true, anything that can drive vascular inflammation deserves attention for modification. So this is not a new message. It's just not talked about enough. But you're going to start to see more of the discussion. Sadly, it takes about 20 to 30 years of good science to be applied clinically. And that's what we absolutely can't wait for. The CANTOS trial demonstrated that inflammation is the cause of vascular disease and atherosclerosis. You know, it's actually a blood clot caused by a rupture or an injury to the artery wall that can change everything. What you'll notice in this picture, and this is why heart disease is so sneaky, this is just a cross section of an artery, and it shows this little development of activity in the artery wall. None of us would feel that. Absolutely none of us would feel that. And I know this looks giant on the screen and it's a cross section, but we have about 30,000 miles of arteries in our body. These little guys feed nutrients to our brain cells. They feed nutrients to our eyes all the way down to our toes. So they're not very big. Some are bigger than others. The one in the abdomen, it's called the abdominal aorta, is about 3 centimeters in diameter, but most of them are real tiny. And so you can appreciate the fact that if plaque, I'm going to call it plaque, starts to develop in this artery wall, we'll have a real problem if inflammation or an injury allows a thinning of this artery wall that can allow that plaque, which is inflammatory, to be exposed to the blood flow. When that happens, it's an autoimmune response that our body actually sends in a clot. Other things can happen other than a rupture, but it's very common that people have a rupture and then a blood clot, and it helps provide understanding of why people feel fine on Monday and not on Tuesday. And if that clot occurs in a vessel in the heart, let's say right here, this muscle is not going to get oxygen, and therefore that heart could possibly stop, causing an event. If the blood clot happens in the brain, we're going to call it a stroke. Regardless of where it happens, whether it be in the brain, in the legs, in the kidneys, it really doesn't matter. In the eyes, it creates an emergency. A blockage of blood flow anywhere in the arterial system is an emergency, and inflammation both drives the development of plaque and drives the development of plaque rupture or an injury to the artery wall, subsequent blood clot, and therein lies the problem. So what does this stuff called atherosclerosis look like before a heart attack or ischemic stroke? I mean, what does it really look like? It looks like us. I mean, no one feels it. You could be in an exercise class, you could be feeling terrific until you don't. And if you are stopped because your body is not getting oxygen, it creates a major problem. And so this is the problem. We as women oftentimes are not recognized of our risk here. We're only recognized as our risk right here when we've had a cardiovascular event. And that's one of the concepts I'm proposing to you is, wouldn't you want to know if you're walking around with plaque in the arteries and if your arteries are inflamed, rather than waiting for an actual event to occur to tell you? So let's talk about awareness for a moment, and let's uncover some common red flags for the development of arterial inflammation. Which one of us as women might be more at risk than someone else to develop that plaque and that inflammation in the arterial system? Let's take a look at some of these. We call them red flags, and there's a lot. I'm just going to focus on a few that are specific for women. So as you can see, there's a plethora of amount of them, and I'm going to hit just a few highlights to make you realize that this is really a global issue. Chronic inflammation can lead to chronic disease, whether we're talking about cancer, whether we're talking about diabetes, arthritis, neurological, pulmonary, and cardiovascular diseases. Inflammation is never friendly to the body. When we look at chronic autoimmune inflammatory conditions, things like psoriasis, rheumatoid arthritis, Crohn's disease, Sjogren's disease, those all show collectively and individually about a 20% increased risk of the development of cardiovascular disease and even diabetes. So if you have a chronic autoimmune inflammatory disease, put in your mindset, I would like to get checked out for vascular inflammation as well as systemic inflammation. I'm going to skirt through these just a little bit. Here's data on Crohn's disease, increasing the risk of coronary artery disease and increasing the risk of a heart attack by 24%. What about rheumatoid arthritis? Do you know that a patient with rheumatoid arthritis is just as likely to die from a heart attack as a type 2 diabetic? And yet, there remains a tremendous lack of awareness. 73 to 97% of rheumatoid arthritic patients were unaware of an increased risk of developing cardiovascular disease in relation to their RA. So if you've got RA or your mother or your sister has RA, you need to tell that individual this data so that they can do something about it. Systemic lupus erythematosus, otherwise known as lupus, shows a twofold increased risk of heart attack for women that deal with lupus. And that was over just a 7-year time frame. Here's one, and we recognize this individual in the picture, Kim Kardashian, West, I should say, who has been very vocal about her risk of, well, her psoriasis basically on television. And why am I glad that she's doing that? Because she's actually showing people that, one, this is very common, but what she's not talked about is the subsequent risk of cardiovascular disease. Severe psoriasis is associated with a 50% increased risk of death, and as many as 5 years lost life explained by cardiovascular disease, infection, and cancer. And do you know that younger patients with severe psoriasis have a 2.5-fold higher risk of dying of a cardiovascular event than their counterparts or their colleagues in school, perhaps? Middle-aged females who have migraines with aura are at increased risk for late life strokes by around 90%. We keep these in the red flag category because honestly, we don't know. Is it the fact that it's the pathology of the migraine? Is it that women with a history of migraines have had a lifelong use of non-steroidal anti-inflammatories for pain management with also increased risk? Is it that women with migraines have a history of poor sleep, sometimes depression because they hurt quite often? We can't tease that out to be specific, but if you or your sister or your mother or your aunt or anyone in your family, your daughter has a history of migraines, make sure that they're checked carefully for vascular inflammation as well. Polycystic ovarian syndrome is associated with increased risk of subclinical vascular disease. It's also associated with other conditions that increase our cardiovascular risk, like insulin resistance, diabetes, cholesterol abnormalities, and even struggles with weight. Matter of fact, women with PCOS, polycystic ovarian syndrome, were 3 times more likely to have heart disease compared to women who did not have polycystic ovarian syndrome. The studies suggest that women in their 20s with PCOS are at increased risk for the development of subclinical vascular disease and should get checked out early. And I'll explain in a moment how you might want to do that. Conditions such as bulimia nervosa also increase our risk for heart attack by around 5-fold and increase the risk of rhythm abnormalities due to electrolyte disturbances and other issues by around 3-fold. So when we look at these conditions, they're never in isolation, and I think we need to be respectful of what our arteries are doing when we're dealing with these catastrophic health issues. You know, pregnancy is often referred to as a stress test, and I 100% agree from that. And it gives us an opportunity to glimpse into our future as far as cardiovascular risk. When women undergo pregnancy, their body is under stress. And so things that might show vulnerabilities can be expressed during pregnancy. Let me share with you what I mean. Preeclampsia, which is a condition that can be a crisis for mom and baby, obviously, is so much in isolation. Matter of fact, preeclamptic women had a double risk of heart disease and stroke 10 to 12 years after the pregnancy. And venous thromboembolism, that's a blood clot to the leg or the lung, in 4 to 5 years post-pregnancy. That's when the child that they delivered is now 4 or 5 years old, or maybe 10 years old, and they forgot the fact that they had preeclampsia during pregnancy. It's associated with a 4-fold increased risk of future heart failure and a 2-fold increased risk of coronary artery disease, stroke, and death. And I'm not telling anyone these to scare them, but to provide empowerment and demand better care. Gestational diabetes is basically a glucose tolerance test over a 9-month time period. Gestational diabetes is linked with a 66% increased risk of future heart disease over a 12-year time period. These women need special care and attention to make sure that their risk of type 2 diabetes after the pregnancy, that their cholesterol is well managed, blood pressure, etc. Preterm birth and maternal heart disease. Mothers who've delivered babies at preterm with low birth rate had a 66% increased risk of heart disease during their lifetime. Women who have multiple pregnancies, over 3 pregnancies, have an increased risk of cardiovascular disease. It's not teased out why. There's a lot of hypotheses to that. It could be perhaps as simple as lack of sleep. It could be hormone fluctuations. Who knows? But the reality is, it's not a statement that you should or shouldn't have multiple pregnancies. But it says if you have had more than 3 pregnancies, at least consider the idea that you might have an increased lifetime risk and get checked out. Okay, let's move away from pregnancy and make some simple sort of relationships. Simply increasing or simply having a higher resting heart rate, and the catch point really is about 76 beats per minute. compared with women who had a heart rate under 60 roughly, showed an increased risk of coronary artery disease events in their lifetime. And it can be an indicator of overall fitness, or it can be an indicator that there's something else going on with that woman, that she carries an increased heart rate over time. But measure your pulse tonight. And if it's over 76 on average when you're at rest, talk to somebody about that. What about our caregivers? There was a really good study, and I've talked about this for a while because it really is important, where they looked at both men and women who were caring for loved ones long term. And women jumped to the front of the line in both stroke and heart attack risk if they were caregivers. And what got my attention is the following: women showed an increased risk of heart attack by 17% if they were the caregivers of somebody ill. They happened to look at cancer, ill for 1 to 4 years. And these women showed an increased risk of stroke by 36% if they were a long-term caregiver of over 5 years. And I would like to softly, if I be so bold as to broaden this, to say women who are caregivers to children who are ill, to perhaps parents, that sandwich generation, whether it's your partner, your spouse, your child, or your parent that you're the caregiver for. Pause for a moment and ask if you're being taken care of appropriately. Heart disease and breast cancer has gotten some attention, which is good because there's a tremendous amount of crossover with the risk factor profile for heart disease in women and the risk factor profile in breast cancer for women. The crossover has to do with a lot of things, but the highlighted ones include things like our age, diet, family history, alcohol intake, hormone replacement therapy, struggling with weight management issues, a lack of physical activity, and tobacco or nicotine exposure both have similar crossover between cardiovascular disease and breast cancer. So if you are dealing with breast cancer, and there's also data to suggest that as women go into the life-saving treatment with breast cancer, even the treatment itself can elevate our risk due to things like radiation, chemotherapy, change in activity, lack of sleep, etc. So we just need to make sure our women who are dealing with breast cancer and fighting it are properly taken care of in regards to their vascular inflammation. Okay. So what do? Let's say you have some of these red flags, or your sister, your aunt, your mother, your cousin. Let's say that you have a history of migraines. Let's say that during your pregnancy, and now your child's in 6th grade, you had preeclampsia. Let's just say that you're a caregiver for somebody and you haven't slept in quite a while. What do you do now? What do you do? The first thing to do is just take a deep breath and say, I need to start advocating for myself and I need to start asking for certain testing. So let me help us all take that first step in the process. So remember I told you that it was actually plaque in the artery wall that can live anywhere in that highway system of ours, and it can jump out at the most unexpected time and cause a problem. So wouldn't it be neat if we could actually find the disease before it caused damage to my heart or my brain? How do we do that? I have said also for quite a while that atherosclerosis is much smarter than the technology that has historically been designed to find it. What do I mean by that? If you look at this image in the right-hand sort of corner of the slide, you see a ultrasound image of an artery. And in the dark areas where blood flows. And that's where traditional cardiovascular testing normally looks at. So whether it be a stress test, an angiogram, or carotid duplex, those are going to tell you if your artery's wide open. But I got to tell you something, the disease is much smarter than that. It actually hides outside that field of view. It hides in the artery wall. So if our field of view is that area of blood flow, we're going to miss the actual inflammatory dangerous plaque just underneath the surface. So if that's true, what can we ask for? I would say we have plenty of technology that's very accessible to look for plaque before a heart attack or stroke develops. Let me share with you a couple things. One is that there are screening methods that are now available for detecting silent subclinical vascular disease. However, you need to be a little bit bold. You're going to have to ask for these tests. These tests are not part of a traditional insurance model. And so it doesn't seem, in a traditional medical setting, it seems odd, doesn't it, that the healthcare consumer would be asking for certain tests. But I believe if we're armed with education, we must be bold and ask for these tests, particularly if you have one of those red flags. I would definitely be asking for these tests. Let me share with you a couple that are really accessible. One that we advocate for is something called a coronary calcium scan. That catches the disease later. It doesn't catch it when it's early and inflamed, but it's readily available and it's pretty easy to do. You just lay down. I've had a couple of them myself, and you lay down and you get scanned, and your heart is scanned, and it looks for just these spots of calcium in the artery wall. And what we can tell is that if someone has calcium in the arteries of the heart, that they've had plaque for quite some time and they definitely need treatment. And you might ask, well, my goodness, I can't afford something like that. I mean, an MRI is thousands of dollars. I can't ask for this. I'm here to break it to you that the cost of this test is anywhere between $50 and $200. And it's not a test that we recommend getting often. But once someone is around 45 to 50 years old, it's a really valuable test to look for any calcium. It can't tell us the soft stuff, but it certainly can look for calcium. So that test is available. I know in the month of February, Inland Imaging does it here in Spokane for $100, I think, 125 perhaps. So you might want to ask about this. Here's another one, and this is really the workhorse tool that we use because it broadens our assessment ability beyond what we would see just with a coronary scan. It's called a carotid intima media thickness test. I know that's a bit of a mouthful, but what we use is this very accessible arterial bed called the carotid artery. It's really easy to get to, as you can see in this image. It just takes an ultrasound beam. It's completely painless. There's no exposure to radiation, and it tells us what your average thickness of your artery wall is. It tells us if you have any plaque development in the artery wall. It tells us if that plaque is stable or active. It gives us a lot of information. And this is a test that those of us who practice prevention enjoy doing on an annual basis so we can go in and make sure the treatment is working, that the disease is stabilizing. And you might say, well, that's great, Dr. Doneen, but I can't afford that. These are expensive tests. And again, I would argue, I would question you a little bit on that because these tests range anywhere from about $100 to $300. And so if you pause and allow yourself to say, I am worth it, and I am knowledgeable, and I want these tests, I guarantee you can get them. And just to put this in perspective, the cost of a traditional heart attack with just maybe 1 or 2 stents, you're looking at about $500,000, and that's without even the job loss issue as well. So I always like to pause and caution people, and I'm not minimizing the value of $100 to $300, but I want to advocate that we deserve it to get these tests, and maybe it takes a year to save up for it, but I would get it. We're not alone anymore. You know, in 2016, the U.S. Preventive Services Task Force, people who tell us what to do on a preventative standpoint, are actually advocating to get this carotid IMT test that I just mentioned to you. Because if you're deemed to be low risk on your risk factors, they say, why don't you just go get it? Maybe you'll be reclassified into a higher risk. And if you've had a heart attack or stroke before and you know you have vascular disease, well, you want to do something to monitor plaque over time. So you should get this test as well to do that. So we're not alone in this recommendation anymore, but the insurance companies do not pay for it as of yet, but it doesn't mean it's not available. So I told you earlier that inflammation is both the driver of vascular disease development and the driver for that vascular disease to misbehave, right, and form a thrombus or a clot. So how do we measure the inflammation of the arteries? Because it's one thing to view structure, it's another to do inflammatory testing. Well, I'm here to share with you some really exciting news. There are simple urine and blood tests that can tell you your arterial inflammation, but again, you're going to have to ask for them. For the sake of time tonight, I'm not going to tell you about all of them. There's several, and not too many. They're pretty cost effective, but there's a few that I think we as women should ask for. And if you go to our website, baildoneen.com, and we have developed an educational program called Arterial Health Assurance for Life, which I'll mention a bit later. The acronym is AHA for Life. FORlife.com. You'll find out about these tests and get educated and armed with the knowledge to be bold enough to ask for these for your own health and benefit. So what are the root causes of arterial inflammation? Like, what are they? We talked about some red flags, but I didn't say those were root causes. I said those are associated risks. What are the root causes of vascular disease for women and for men? But let's focus on women. There are several root causes of vascular disease, and they go above and beyond those 6 key points that the Red Dress campaign advocates for. They go beyond blood pressure. They go beyond cholesterol. They go beyond lifestyle. It doesn't mean I'm ignoring those things. They're critically important, but it's not enough. We need to do more. So let's talk about just a few of them. And then we're going to jump right in to close this meeting with a 10-step action plan to do right now to be healthier when you wake up tomorrow. So just in discussion of these root causes, airway and sleep is a huge category of vascular inflammatory driving forces, whether it be lack of sleep, whether it be sleep disruption. Maybe it's an airway issue when someone has an obstructive airway. And by the way, children and obstructive airway disease is a really big deal. If you have a child, a grandchild, a niece or a nephew who snores, that is never okay. It's never okay. And the earlier that child can be intervened on to make sure that they maintain a patent airway through their lifetime, the less inflammatory burden they're going to have throughout their lifetime. So moms and grandmothers and aunts, please assess the children in your life for any breathing problems at night. Lipoprotein A has gotten a lot of press in the last couple of years. Why? Because our good friend Bob Harper from The Biggest Loser had a heart attack. And everyone thought, well, Bob Harper can't have a heart attack. He's the healthiest guy on the planet. He's the one who's paid to help us all get healthy. And yet he had one. So what caused his? His was actually lipoprotein A. And it's not a novel factor. I'll circle back to it in a moment, but it's very available to test for. It has about a penetration rate in the US of about 24%. So 24% of us have it. If you do have it, it's very treatable, but you've got to find out if you have it. It's found on chromosome number 6. You didn't do anything wrong to cause it. You just need to know if you have it. If you don't, you don't. Low vitamin D has been proven to have data and a concrete enough evidence base that we do put it under our root cause tree. Normal vitamin D should be above 30. High blood pressure. What is high blood pressure? That's the big whammy, right? High blood pressure is anything above 120 over 80. If your blood pressure is over 120 over 80, you are at risk for vascular disease. High cholesterol is a problem, and it's not just our LDL or our total cholesterol, it's the whole profile of lipids, which I'll circle back to in just a minute. Periodontal disease is absolutely a root cause of vascular inflammation. Genetics, I'll circle back and talk about as well. The time is now that we can be appreciated for our own unique individual risk profile. Insulin resistance, I'll circle back to that as well. That's a big one. And sadly, women aren't told they're insulin resistant until they contract, or not contract, but until they develop type 2 diabetes, which means they've been insulin resistant for about 20 years. And that whole time, the arteries have been beat up. Another one is dysfunctional HDL, where our good cholesterol doesn't work very well for us. Endodontic disease, which is decay and infection of the tooth. That is absolutely an independent root cause of actual heart attacks. Autoimmune diseases, we talked about some of them earlier. Infectious diseases, influenza is one of the main drivers of heart attacks. Influenza. And so the idea of avoiding that through hand washing techniques, vaccinations, absolutely we're fans of, including vaccinating against shingles, which absolutely increases our stroke risk. If you get shingles in the eye, your stroke risk is up 4.52-fold within 1 year of that shingles outbreak. Psychosocial issues, ideas like stress, anxiety, post-traumatic stress disorder, absolutely drive vascular inflammation independently and aggressively. Myeloperoxidase, which we really don't have time today to talk about, but it indicates an injury of the artery wall. We have found a driver of myeloperoxidase to be very commonly found to be endodontic disease or tooth decay that we find very compelling. Nicotine exposure of any kind. The American Heart Association still talks about avoidance of smoking. Smoking's out, it's not cool anymore, but vaping is a huge problem, so I want to talk about that. Gut dysbiosis is huge. Our gut is a huge organ. And if we have inflammation stemming from our gut, whether it be a innate autoimmune issue, an irritable bowel issue, a sensitivity to certain foods issue, when the gut is inflamed, our arteries definitely demonstrate vulnerability. And so gut health is incredibly important in this story as well. And then lastly, lifestyle challenges are really important also, and I'll talk about a few of those. So you can appreciate just looking at this root cause tree that it goes beyond those simple 6 steps by the American Heart Association that we're supposed to eat right, whatever eating right means. We're supposed to exercise regularly, whatever exercise regularly means. We're supposed to get our blood pressure checked and our cholesterol checked. But there's so much missing to that. So let's talk then about what we can do. So going back to the American Heart, and I am not picking on them, I really respect their work, but I felt like with these compelling social statistics out there that we're not doing better, and we've been at this for 17 years, it's time to draw a line in the sand and say we need to do better. The graciousness of Susan Lucci has been tremendous. Susan Lucci, when we look at this beautiful woman, has done these things. She's not smoked. She has managed her blood sugar. She has managed her blood pressure. She has managed her cholesterol. She did know her family history. She was incredibly active. She obviously does not have a weight issue. She eats very, very healthy. And yet she was blindsided with a heart attack requiring 2 stents. So if it can happen to Susan Lucci, it can certainly happen to the rest of us. And if you look at that list and feel, well, it's just destiny. I mean, what else can we do? Understanding the plethora of opportunity under that root cause tree, you can appreciate that you can be checked. If Susan Lucci had simply had that carotid IMT test or a coronary calcium scan years or 1 year, 6 months, perhaps even before her heart attack, she could have been told, you have vascular disease. Let's find out why. Let's treat the why, see the inflammation go down, and make sure you are safe. Okay. So 10-step program, and I have about 10 minutes to do it. So let's take a deep breath and learn how we can be healthier tonight. So when you wake up tomorrow, you're going to make little small changes at the end of a year, make a big life change. The first one I would argue is we must get educated. As very well said by Eleanor Roosevelt, no one can make you feel inferior without your consent. No one. And some of these things I'm advocating for, you are going to have to ask for. But with education and having the science as your backbone, you can ask for this. And if it's too expensive at the moment, if $200 is too much, perhaps save for it and ask for it again. We have been working tirelessly to arm you with information. Our book, which was published in 2014, called Beat the Heart Attack Gene, has a tremendous amount of resources, talks about these topics, and every chapter is armed with the data to say, I want to get this testing and here's why. So we really use that piece of literature to educate people. And then we realized about 2 years ago that not everyone likes to read, which is fair. And so we really worked hard, Brad Bale and myself and colleagues, Randy and Gina and others, Michelle and Sarah, we really put a team together and said, okay, how are we going to get this information out? And we developed a 12-module series, and it's called AHA for Life. Arterial Health Assurance for Life. And basically it's free. You go in, you put your name in, you take a little quiz, and you get educated. The whole first module is free for everybody. So if you do nothing else, you like to read the book and watch these videos, because what it's going to do is get you educated further on that inflammation drives disease. You've got to get tested. It's going to help you articulate what your root causes are, and it's going to help you know what to ask for to monitor your inflammation. Remember, protecting your heart protects your brain against stroke and memory loss. And we dive into that heavily in this AHA for Life program. Number 2, lifestyle matters. So what I want people to appreciate, it's not always what we weigh that demands our health or not. I always remind everybody that there are a lot of unhealthy, skinny people out there. And just because one person may struggle with their weight does not mean they're not healthy and active. And vice versa is true as well. So please don't let the scale scare you. You can be creative as this woman is doing. But I want to advocate something else. I want to advocate that we get a tape measure out. And I want to show you that our waistline is 7 times more predictive than our weight. And in the ideal world, whether we're 10 years old or 100 years old, we hope that our waistline, which is just above the hip, kind of think about where your belly button is, the thickest part of your waist is the easiest way to say it. There are more specific guidelines, 2 inches above the iliac crest, blah, 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 but just kind of go to the thickest part of your waist and put a tape measure around it. And if it's over 35 inches, and it doesn't matter if we're 6 feet tall or 5 feet tall or 4.5 feet tall, if it's over 35 inches, you have increased risk. So part of our focus should be a real pat on the back if we could lose an inch in the middle. And 1 inch is a tremendous impact on our cardiovascular health and our diabetes risk. Nothing happens overnight, nor should it. So losing an inch around our waist yields tremendous benefits for cardiovascular improvement. So feel very excited when you see that 1 inch change on the tape measure. I also want to mention mindfulness as a form of cardiovascular risk reduction. You know, there was this really great study, and it looked at mindfulness and meditation, and it gave people sort of homework, and it said, I want you to go be mindful, and it taught them of different techniques, whether it be deep breathing, whether it be through prayer, music, drawing in sand, whatever that mindfulness technique works for you is. You were instructed in this study to do it for about 15 minutes a day, and compared to a group that wasn't taught mindfulness, but was told about the negative effects of stress. And then they followed the group for 6 months. And amazingly, what it demonstrated, if we practice mindfulness regularly, we can reduce our blood pressure, we can become more sensitive to our insulin and reduce our risk of metabolic syndrome and even diabetes risk. We can reduce our stress, our nicotine use, our artery wall gets healthier, and it's effective in both primary and secondary prevention, and it even helped with chest pain. There is no drug that can claim the magnitude of those benefits. So please practice mindfulness, and we advocate at least 15 minutes a day. This trial was wonderful. Simple optimism lowers cardiovascular risk by around 35%. And I think optimism can be taught in our body through mindfulness. There's a lot of negativity out there in the world. The political pulse is very volatile on both sides of the aisle, if you will. And people need to understand that we need to find ways to keep our bodies healthy. And so mindfulness is a way to promote optimism within our own mindset. And I will close on this part to say, stress is defined as being in an environment for which we individually perceive a lack of control. So part of the value, sometimes we cannot change the environment we're in, whether it be workplace or more globally, politically, or whatever. If we can't change the dynamic of where we're at in life, what we can do is change our perception to it. And if we can change our perception to more of optimism, there's true data to say that will lower our cardiovascular risk, which is terrific. There are a lot of free mindfulness apps online, and I'm a huge fan of all of them. I've tried several, and I don't want to advocate for one or the other, but do your homework a little bit. They're free, and they're really valuable techniques. Number 3, we've got to move more. as a society. Do you know that a lot of people just value exercise or physical activity for weight loss? They say, well, I was active last year. Man, I really put my heart and soul into it and I didn't lose a pound. And it frustrated me and I didn't like it anyway, so I stopped doing it. Well, what I always like to share is that maybe things are going on in the inside of our bodies that we're not quite aware of on the outside. Because we do know that being physically active promotes nitric oxide or oxygen to the artery wall, and it actually lowers inflammatory aspects of artery wall health. So don't gauge always physical activity by one biomarker like weight. Understand that physical activity lowers our vascular risk tremendously. You know, women with healthy lifestyle factors in place compared to those women who didn't showed a 92% reduced risk of heart attack. So absolutely lifestyle and exercise and being active matters. Did you know that exercising even 22 minutes per day reduces a risk of heart attack or reduces risk of heart disease by 14%? And if you look at all of these beautiful people being active, let's look at some data with these because it's really exciting to me. You know, we have walking, right? So daily walking showed data to reduce all-cause death and heart disease. Tai Chi practiced just for 3 months was comparable to a formal cardiac rehab program. What about resistance training? Resistance training improves insulin sensitivity, reduces weight, improves muscle mass, and reduces risk of diabetes. What about yoga of all shapes and sizes? Yoga works. It improved cardiovascular risk, reduced blood pressure, and cholesterol parameters overall. So whether you walk, whether you run, whether you enjoy other things like Tai Chi, resistance training, and yoga, have at it. And the more variety we can have in our exercise, I believe the better we're going to be for overall health and injury prevention, etc. Huge fan of being active. Be an example for those around you. Children learn from our behavior. So if we're active, children are usually more active and within a household. And so keep that in mind. And I know a lot of us exercise early in the morning, which is great, but I'm always an advocate if people have children at home to let them see you exercise, let them see you prioritize their crazy busy life to say, Mom needs to go exercise right now. It's important for my health. And they'll learn from that. So these little subtleties do make a difference. Okay, number 4. The American Heart Association and others talk about smoking, but it's more important than that. Nicotine exposure in any form accelerates a woman's risk of having a heart attack by at least 10 years. They present to the emergency room about 12 years earlier than their male counterparts for those women exposed to nicotine. And when you look at cigarettes and vaping, there's a 5-fold increased risk of heart attack compared to non-smokers. I know that vaping is hopefully going to get out of favor and possibly pulled off the market, which is great. But I wanted to just visit it a little bit because I still see a lot of people doing it. And I wanted to just advocate that vaping, even without the nicotine, causes cardiovascular risk through all kinds of different reasons. But we know vaping that includes nicotine and just vaping with other products increases risk of thrombosis, impairs vascular repair capacity, increases the risk of cardiac arrhythmias like AFib, reduces the heart function, induces myocardial, that's the heart muscle, dysfunction, and it creates things like heart failure, and it also increases blood pressure. Why am I telling you this right now? I'm telling you this because when you look at the data, the percentage of adults in the US who had tried vaping or using electronic cigarettes as of 2018 by gender, much more popular in women than in their male counterparts. And that's concerning because it showed that 60% of these women had tried vaping, and you know, the addictive nature of nicotine can happen pretty quickly in some people. So we need to be advocates that it is a huge problem. And I think to ignore it would be foolish. We need to start talking about it. Okay, number 5, know your genes. Our genes provide the opportunity to be treated as an individual, not as an average of a larger population. Genes help us understand how we metabolize meds, respond to exercise and diet, dental health, and even when we should be screened for certain things. The knowledge is out there. Again, we just need to find it. People are very voiced in the idea of getting their own genetic tests, right? You can go to Target and you can buy a kit to find out where your ancestors are from. You can buy a kit to find out what color your eyes are, even if you already know. You can find a kit to know what likelihood you are to go bald or have earlobes that crease or not, or attached to your face or not. We have advocated for a pooling of genes that are specific for cardiovascular health and wellness. And we have these available through a finger stick test through our AHA for Life program. The cost of getting all 5 of these genes is less than $360, which it's a lifetime sort of thing. You only do it once, which is encouraging. But we look at things like the ApoE gene, which helps us understand how we respond to certain diets, such as how much fat should be in our diet, or should we use a low fat? Should we be vegan? Should we do Mediterranean? Even how we respond to alcohol and exercise. Haptoglobin is amazing. It helps us understand how our body responds to gluten intake and if there's an inflammatory component to different individuals based on their gluten intake, which is important. KIF6 helps us understand our lifetime risk of developing cardiovascular disease and provides a response to certain treatments such as statin therapy. We're going to make a choice based on that individual need. 9p21 we call the heart attack gene. Why? Because it evaluates our lifetime risk of developing heart disease and even aneurysm risk. 4q25 looks at our lifetime risk for developing atrial fibrillation, which there are so many things we can do to prevent AFib. But be aware, you should get your genes tested. The time is now. And these are not collectively done through the other genetic testing companies, but you deserve to have them. Number 6, we walk into interesting cholesterol problems as we age. We all know about our bad cholesterol like LDL, but what about the others? Do you know that as we get older and lose our own endogenous estrogen production, it's called menopause, that our HDL falls to levels similar to our male counterparts? HDL, think high or happy. It's the high dense lipoprotein. The more, the better. So sometimes it's a matter of not lowering our cholesterol, but it's, are we doing enough to increase our good cholesterol? And you know what? HDL is like food for the brain. The higher your HDL is, the lower your stroke risk, which is amazing. And there's also data with memory benefit. Matter of fact, if your HDL or good cholesterol is less than 40 versus greater than 60, you have an increased risk of memory loss by 53% by the age of 61. So when we look at HDL in an individual's profile, we want to make sure it's as high as possible because it actually has great ability to protect our brain, both for stroke risk and memory. Lipoprotein A, that's the one I mentioned earlier about our dear friend Bob Harper. Lipoprotein A is a genetically inherited lipid abnormality. It's found on chromosome number 6. And if that's all you had under that tree, you are at independent risk to develop a heart attack at even a young age, like Bob Harper. And I will advocate this is a very treatable risk factor. You just need to know if you have it. And it can be measured at any lab across the country, Quest, any of them. Okay, number 7, and I have 2 minutes left, so I'm going to cruise through these. Prediabetes and diabetes. Do you know that 7 out of 10 people who have heart disease have insulin resistance or prediabetes? You also know that 50% of stroke patients are pre-diabetic. The other thing that's important is, do you know it takes about 20 years of being pre-diabetic or insulin resistant until the beta cells in our pancreas are finally so worn out that we are told we're a type 2 diabetic. So we're walking around down this 20-year path, and we're virtually being ignored until we have diabetes. And during that whole 20-year cycle, the arteries are being beaten up from inflammation for all kinds of reasons, which we go into detail in the AHA for Life program. I don't have time tonight. By the time a woman gets the diagnosis of type 2 diabetes, she has had 20 years of vascular damage and inflammation caused by the syndrome of insulin resistance, which becomes a sugar problem, absolutely, when someone's diabetic, but it's the syndrome of insulin resistance that's the issue. And it's a very inflammatory, dangerous condition for the arteries. 86 million people have diabetes, and 9 out of 10 of those people don't even know they have it. So what do you do? How do we find it? First, recognize the prevalence. So it's pretty darn common. And those that do have prediabetes or insulin resistance have a 3-fold increased risk of ischemic strokes, independent of traditional risk factors. So if type 2 diabetes is preventable, which I'm here to tell you it is, how do we do that? Like, if that's true, if I don't have to become a diabetic, even though my mother was, my grandmother was, and I had gestational diabetes perhaps, how do I prevent it? Or is it just destiny? The first and most important thing is to find out if you are pre-diabetic. And the best, most efficient, most practical, most precise way to do it is to get an oral glucose tolerance test, just like we had when we were pregnant. It's a 75-gram glucose load. The lab checks your sugar at 1 hour and 2 hour, and it far out predicts a fasting blood sugar and a hemoglobin A1C. Know your risk. Do not wait for diabetes to find out you are insulin resistant. Certain medications and lifestyle can prevent risk of becoming type 2 diabetic by virtually 100%. And the earlier we find out you're on this 20-year path, the more opportunity we have to kick you off of it. So demand a glucose tolerance test. If you have a family history of diabetes, if you have any of the risk factors that might include blood pressure, low HDL, increased waistline. I could go on and on. We talk about that in our courses in our book. Number 8, please, please, please take care of your gums and teeth. It's so important. We've known since 2012, actually, that there's a direct association with periodontal disease and heart disease. And then Brad and I and Dave Vigorous published a couple years ago that there's actual pathogens or bacteria that can live in our gum line that can absolutely cause atherosclerosis. These pathogens or bacteria that can live in our gum line can increase the concentration of cholesterol problems. They can increase the vulnerability of this very protective lining of the artery called the endothelium. And if you can believe this, they can actually trap those bad cholesterol molecules in the artery wall here and create fatty streaks and plaque development. You do not have to have bleeding gums or gum recession to have these pathogens. You've got to be tested for them. If you've got active periodontal disease, you have about a 4-fold increased risk of having a heart attack and a 2-fold increased risk of having a stroke. There's also data with memory in some of these pathogens because they affect the microvessel system so profoundly. And you can get tested for this. Ask your dentist and hygienist to get tested for these bad bacteria. It's a simple saliva test. And if you've got them, there's so many things you can do. You can increase your home care. You can go to the dentist more often. There's so many things that we can do to control this in our own body. And so I'm an advocate to get tested for the bacteria. Sleep is so important, whether it be lack of sleep, whether it be sleep interruption, it is such a big deal. And there's all of this data, and I just want to kind of summarize it for you. But if we get on average less than 6 hours of sleep per night, on average, it increases our risk of stroke by 83%. Shows a 5-fold increased risk of getting diabetes, and it increases the risk of obesity by 27%. If we add in or take in isolation obstructive sleep apnea, that actually doubles the risk of dying from a heart attack or stroke. So if you are having sleep issues, whether it be menopause, whether it be a bed partner that's noisy, whether it be dogs on the bed, a train going by, getting up to go to the bathroom too often, or having an airway issue, that is something that should take priority right now to get fixed, because sleep is a critical component. And then finally, and in closing, number 10, please know that you matter. If 1 out of 3 of us on this call as women are going to suffer a heart attack or stroke in our lifetime unless we do something different, it's our job to start talking about this. I ask that you pick just two things from this talk tonight, whether it be that inflammation drives disease and you can look for disease, or migraine headaches increase, or I don't care what it is, 2 things. I want you to call a friend up when I'm off this call and tell them about those 2 things. Teach them about it. Save a life while you're at it. Never underestimate a woman's ability to find out the truth. And if we all hold our own education up, The intention is that we can stop these statistics because it is time. It's absolutely ridiculous that we have a tenfold increased risk of heart attack than breast cancer. And I hugely respect breast cancer. My mother had it, but I think they got a 40-year head start on us as far as advocacy and education, and we just have to do better. Remember, this program is going to be recorded. You can watch it over and over again. You can share it with as many people as you want. I ask you for an action item upon leaving. Please go to our website and pull up ahaforlife.com. It's called Arterial Health Assurance for Life. It is a free program for you. Just jump into it, watch that first module. There are ways to watch all 12 if you're interested, but start somewhere and share this with others. We are huge advocates that we all live healthier starting now. So I want to thank each of you sincerely for being proactive with your health. I advocate that women deserve better cardiovascular care. And I truly believe it's been such an honor to spend this hour with you. So I thank you so very much. I was trying to have the camera on to say hi, but it wouldn't come on for me. So I am here to say hi to you and thank you for your time. So with that, I'll go ahead and close. Thank you very much.